My name is Kathie, and I'm the Central Operations Office Manager here at Catalytic Health Partners.
What drew you to healthcare?
So I started off very young in healthcare. I was very fortunate to have been introduced to healthcare at a very young age, and I was drawn to it because I always wanted to help people. I always knew that there was something that I wanted to do more than just for myself, but for others. And I originally got into healthcare working as a respiratory therapist. And I worked in a hospital for quite some time, and being in that environment and seeing what was done in the background was something that really inspired me. And I wanted to help others, not just hands-on, but socially as well. So that's what really drew me to healthcare.
Fantastic. And tell me a little bit about your role and your primary responsibilities here at Catalytic Health Partners.
So my role here is to ensure that all our members' needs are being met, and ensuring that everything in the background is being done. So we have everyone in our field ensuring that all our members' health needs and social needs are being recorded and sent to the office. And here at the office, we ensure that we find and locate those resources to be able to provide to our members. And it can be anything from food boxes to simple transportation to their doctor's appointments, and monitoring their vitals on our end, and coming up with ways to better help our members socially, mentally, and physically as well. And so we set up those appointments, we get them their needs, we help them with paying their rent, and we are responsible for finding those resources within the community and helping our members get those and utilize those resources to its full potential.
And you have a team of people that work for you here in the office. Tell me about the responsibility of the headquarters office.
The responsibility is huge. So we are the main point of contact. So we are the voice of Catalytic Health Partners. So when our members first call us, we're the first people that they hear. We are the foundation of Catalytic Health Partners, and our members rely on central operations to help them with whatever it is that they're needing. When they're in distress, they will call us first. When they are needing something socially, or something is going wrong with their homes, or anything that is going on with them at home, or some of our members are homeless, or if they're hungry, we're the first point of contact. So our office is mainly responsible for taking that information and distributing it through the field and reaching out to resources within the community to see how we can help our members.
That's huge. Tell me 3 things that you love about your work.
I love helping people, and I know that is going to be very, across the board, everyone loves to help people, but I love the reward, that feeling I get when I know that I was able to do something for someone else. And that's like the best feeling in the world. I can truly say that there isn't a day where I don't want to be here. Hearing our members' voices and how happy they are to have someone like Catalytic Health Partners in their life is such an amazing feeling. I also like that I become a part of their family. A lot of our members know us by name. They call us and they ask for us specifically, and they want to talk to someone. And having someone that we can talk to every day on a daily basis is a lot of fun. It's very rewarding. So I would say that I love helping them and being part of their family. And lastly, I would say that the thing I love the most is just being involved and constantly growing and learning. And here at Catalytic Health Partners, every day is so exciting. You're not going to get a dull day. Everything is going to be different. You're constantly learning. Healthcare is growing, so there's always room for opportunity to learn. So those are the top 3 things that I mostly enjoy. And I'm looking forward to whatever else we have to bring us in the future.
That's fantastic. Can you share with us a member experience that made a difference, or improved an outcome, or enlightened the client in a better way to achieve their goals?
Yeah, so are we allowed to say names?
For sure.
Okay. So originally when I first started, back in September, we were doing what we call here at Catalytic Health Partners the onboarding portion of our enrollment program. With that being said, a number of team members work on reaching out to our members and really informing them of the services that we have and what we're able to do for them. During that time, I was able to witness our team reaching out to several members, and one of them being, his name is David. So David was very resistant and did not want anything to do with Catalytic Health Partners. He was used to being told no. He had recently got his leg amputated, and he was very angry at the world. He was so used to everyone telling him no and turning him away, and what we had to offer to him was simply a dream come true that he could not believe was actually happening. And he shut us away a couple of times, and as our onboarding season came to a close, we realized that this member was struggling a lot. And the reason why we knew that was because we are able to get data from the hospitals to see which ones of our members are reoccurring in the hospital, and David was one of them. He was struggling financially, his health was deteriorating, and he didn't have that social and mental and physical support that we were able to provide him. And so just as onboarding came to close, we were able to onboard him, which was amazing. And he was still very resistant at first. And it's been amazing seeing him grow with us. And he has turned from someone who is very resistant and not caring to someone who calls us every single day just to say hello or to see how we're doing. And it's just been amazing seeing his personality and his spirit just change completely. He is visiting the doctor on a regular basis. He hasn't gone to the ER, and he is getting full treatment for his amputation. And he's just such a happy guy. So he went from someone who was used to being told no every day of his entire life to someone who is confident and can call us and isn't afraid of what we're going to tell him, because he knows that we're here to help. So that was such an amazing turn of events there. And so that was really, really rewarding to be able to witness.
Absolutely. If health plans knew this, they would always choose to partner with CHP to improve health outcomes for their members. What is this?
If they knew what we were able to do for our members socially, it would be life-changing, I feel. Okay, so if health plans knew that what we were able to do for our members socially, mentally, and physically, it would be life-changing. For one, I would say what separates us from most population management companies out there is that we don't necessarily focus on the health part. We're trying to fix what is going on with them socially to help improve their mental and physical outcomes. And I think that that is where the biggest downfall is, as people in healthcare don't really realize what is the driving factor for these members being high risk or high cost. And if they knew what we were able to do, if they knew the resources that were available to our members, they would want to partner with us because we were able to help them essentially in that field. So we would take all on that responsibility and say, hey, you have someone who's very sick, but let's figure out how we can help them socially to help improve their healthcare outcomes. And I feel that although, saying socially, it just goes way further, deeper than just what's on the surface. I would say a lot of our members don't even recognize that they have something socially going on until it's being asked. And what separates us is that we really become their partner, and we want to know, we want to walk with them and help them on this journey to better improve their health. So what separates us and what they should know about us is that we're not just a company that's going to help reduce costs. We're a company that's going to improve our members' lives.
What one thing should people know
That's an interesting question. Sorry, I wasn't expecting that one. What should people know about me? That's a hard question. People should know that I'm just very caring and loving and wanting to help. I just want to help. I want to come up with new ways to help people, and my mission is to change healthcare and how it's perceived. And so it's going to be a long journey, but that's my end goal, and I'm sticking to it.
Fantastic. So if you could be any superhero, who would it be? Why?
If I could be any superhero, it would be Doctor Strange. Sorry. Dr. Strange, he's just like a wizard, and he has the ability to change time. He has like this time stone. Sorry, I'm like a nerd. And he's a doctor, so he's a healer, and so that's why I would choose him, because he's a healer, and he's someone who stands for the people, and he's protector of the realm, and so I would be him.
Perfect.
Sorry.
That is perfect.